Hello and welcome to our video on the secret life of Münchausen syndrome sufferers. When seeking help becomes an addiction, are you ready to uncover the hidden world of medical fraud and explore the dangerous consequences of seeking attention? Join us as we delve into the complex and often misunderstood world of Münchausen syndrome and learn how to recognize and support those affected by this serious disorder. Münchausen syndrome, also known as factitious disorder, is a rare mental disorder in which a person intentionally produces or exaggerates symptoms of physical or psychological illness in themselves in order to seek medical attention. While the term Münchausen may conjure images of Baron Münchausen, an 18th century German nobleman known for his tall tales, the syndrome is named after him due to the exaggerated or fabricated stories told by those with the disorder. At its core, Münchausen syndrome is a form of self-harm, with individuals often going to great lengths to obtain medical care and attention. They may visit multiple doctors and hospitals, undergo unnecessary medical procedures, and may even create false medical records in order to maintain the appearance of being ill. This can lead to significant physical and emotional harm, as well as financial consequences. One famous example of Münchausen syndrome is the case of lonely heart killer Gwendolyn Graham, who was convicted of the murder of 5 elderly women in the 1980s. Graham, a nurse's aide, had a history of seeking medical attention for a variety of fake or exaggerated ailments, and was eventually diagnosed with Münchausen syndrome by proxy, in which a caregiver fabricates or causes symptoms in someone else. The exact cause of Münchausen syndrome is not fully understood, but it is thought to be related to a combination of psychological, social, and environmental factors. A history of abuse, low self-esteem, or a need for attention and validation may play a role. Risk factors for the disorder include a history of medical or psychiatric problems and a job or family role that involves caring for others. Diagnosing Münchausen syndrome can be challenging, as patients may provide false or misleading information or may be unaware that their symptoms are not genuine. It is important for healthcare providers to consider the possibility of Münchausen syndrome in cases where the patient's symptoms do not match the expected course of their illness, or where there is a discrepancy between the patient's reports and objective findings. Treatment for Münchausen syndrome typically involves therapy, such as cognitive behavioral therapy or psychoanalytic therapy, to address the underlying psychological issues and help the patient learn healthier coping mechanisms. Support groups and education about the disorder may also be helpful. It is important to seek treatment as early as possible, as the disorder can have serious consequences if left untreated. If you or someone you know may be suffering from Münchausen syndrome, it is important to seek help from a mental health professional. Treatment can help individuals with Münchausen syndrome learn healthier ways of coping and improve their overall quality of life. The typical behaviors and actions of someone with Münchausen syndrome may include exaggerating or fabricating symptoms. People with Münchausen syndrome may exaggerate or completely invent symptoms in order to seek medical attention. They may describe unusual or severe symptoms, or they may present with a wide range of seemingly unrelated symptoms. Seeking multiple medical opinions. People with Münchausen syndrome may visit multiple doctors or hospitals in search of a diagnosis or treatment for their supposed illness. They may be willing to travel long distances or try unconventional treatments in order to find relief. Undergoing unnecessary medical procedures. People with Münchausen syndrome may agree to undergo unnecessary medical procedures, such as surgeries or diagnostic tests, in order to maintain the appearance of being sick. They may also tamper with test results or damage their own tissues in order to produce symptoms. The consequences of these behaviors can be significant and can include physical harm and emotional distress. The physical harm may result from the unnecessary medical procedures or from the side effects of medications or other treatments. Emotional distress may result from the fear and anxiety of being ill, as well as from the strain on personal relationships caused by the disorder. The consequences of Münchausen syndrome can be significant and can include physical harm and emotional distress. The physical harm may result from the unnecessary medical procedures or from the side effects of medications or other treatments. For example, in a case study published in the Journal of Medical Ethics, a patient with Münchausen syndrome underwent multiple unnecessary surgeries, resulting in multiple scars, an ileostomy, and a urostomy. Schreiber J. and Spitzer C. 2004. Münchausen syndrome. A review of the literature. Journal of Medical Ethics, 32, page 113-117. Emotional distress may result from the fear and anxiety of being ill, as well as from the strain on personal relationships caused by the disorder. In a review of the literature on Münchausen syndrome, Schreiber and Spitzer 2004, note that individuals with the disorder may experience depression, anxiety, and a sense of shame, page 115. In addition to the physical and emotional consequences, Münchausen syndrome can also have financial consequences, as individuals with the disorder may incur significant medical expenses as a result of their seeking unnecessary medical care. The legal implications of Münchausen syndrome can vary depending on the specific actions of the individual with the disorder. In some cases, the behaviors associated with Münchausen syndrome may be considered fraud if the individual is intentionally seeking financial gain through their actions. For example, if someone with Münchausen syndrome intentionally seeks medical care or procedures that are not necessary and bills insurance for these services, they may be committing insurance fraud. In other cases, the legal implications may be related to child abuse or elder abuse if the victim of Münchausen syndrome by proxy is a child or an elderly adult. If a caregiver is found to have fabricated or caused symptoms in a person under their care, they may face legal consequences for child abuse or elder abuse. It is important to report any suspected cases of Münchausen syndrome by proxy to the appropriate authorities, as the disorder can be dangerous or even deadly for the victim. It is also important to seek help and support for individuals with Münchausen syndrome, as the disorder is a serious mental health condition that requires treatment. In conclusion, Münchausen syndrome is a serious mental disorder in which a person intentionally produces or exaggerates symptoms of illness in order to seek medical attention. It is important to be aware of the signs and symptoms of Münchausen syndrome and to seek help if you or someone you know may be suffering from the disorder. With proper treatment, individuals with Münchausen syndrome can learn healthier ways of coping and improve their overall quality of life. If you suspect that someone you know may be suffering from Münchausen syndrome, it is important to report your concerns to the appropriate authorities and seek professional help. References: American Psychiatric Association, 2013. Diagnostic and Statistical Manual of Mental Disorders, 5th ed. Arlington, Va. American Psychiatric Publishing. Mayo Clinic, 2018. Factitious Disorder. Retrieved from https://www.mayoclinic.org/diseases-conditions/factitious-disorder/symptoms-causes/sick-20,355,070. National Institute of Mental Health, 2018. Factitious Disorder. Retrieved from https://www.nin.ner.gov/health/topics/factitious-disorder/index.stel. Schreiber J. and Spitzer C. 2004. Münchausen syndrome. A review of the literature. Journal of Medical Ethics, 32, 113-117. Thank you for choosing to follow our channel. We are so grateful to have you as a subscriber and can't wait to share more content with you in the future. This video was produced, directed and written by Dr. Joe Inobong.